Hello, it's Dr. Jen. So super excited to have Dr. Robin Rose. She is an MD. We actually met online through personal Facebook groups, and I just fell in love with her personality. She started a great peptide group on Facebook where we all bounce off ideas off of each other, and it's so great. So let me tell you a little bit about Dr. Rose. So she first was a family nurse practitioner in 1984. You wouldn't believe, she looks fabulous. Then she went to medical school and graduated with an MD in 1991 from the University of Arizona Health Science Center in Tucson, Arizona. She did her internship in family medicine at UCSF in Santa Rosa, California, and residency in family and preventative medicine at Community Hospital UCSF in Santa Rosa, California. She is board certified in family medicine, and then she did opt out of practicing. She'll tell us a little bit about her story later on, but she had a great and thriving practice in Oregon, and right now she does tons of educating and is kind of being a trailblazer in a bunch of things. So welcome, Rose. Thank you for being here. So
Thank you.
excited for you to share your journey into preventative medicine, and kind of starting with that, you're going to go all into it, talk about renology and your history and your passions.
Thanks. Well, I really went to medical school to be an innovator. I had gone to nursing school and then did a family nurse practitioner program. And really, I appreciate the nursing input because the focus in those days and the training for nurse practitioners back then was actually way more stringent than what I'm seeing now. Was really learning about prevention, that the role was to really guide people to avoid the things that cause the problems. And so I brought that along with me to medical school and had the great benefit of having Andrew Weil at my med school. So that really helped in how to plant ideas about holistic thinking into the education that we all got. I came up with different conclusions than some of my classmates did. And then I was also brought onto the board of the Holistic Medical Association as a med student. So, I surrounded myself with this awareness that it's always prevention. From hello, we start with prevention. And so, in the decades of practicing, I've pretty much evolved that as just a standard. And I had a few difficulties in practice, like I got embezzled, talk about a stressful plant of illness, various issues that led to my selling my practice and looking for what was next. And I came to Hawaii with my new husband, and not that long ago, like a decade ago now, and unfortunately started being sick, spiking blood pressures, holistic doc lady having health problems. It's like, who, me? And ultimately was diagnosed with a rare kind of renal cell carcinoma. Was not what I had in mind for moving to Hawaii, but ended up having a nephrectomy, coming back to this beautiful place that I live 3 weeks post-op, and over the next few months realizing that the great promise that living with one kidney was fine was actually a bit of fake news. And unfortunately, when I went back to get a checkup, because I was flying back to Oregon to complete the care that I started there, I had the great awakening that I had significant chronic kidney disease. I had a GFR of 30, which in essence is a 25% function. So much for you're fine with that with one kidney, which in fact, so I was getting really bad advice. Like, either don't worry or you're going to lose 5% a year. And, 5% a year with 25% was unacceptable with this new marriage I had, this new life. And so it really forced me to take a look at what do we know? I mean, as a primary care doctor, I realized I didn't know enough about kidney. I mean, yeah, it filters and you treat the blood pressure and the diabetes, that was all anybody knew. I mean, some of my mentors, my medical mentors, they didn't know either. So all of a sudden I was like, oh my God. And, when you look at Chinese medicine, kidney and fear, not a good mix. And there I was like almost, paralyzed in fear. Like, I don't know what to do and I don't know who to ask. And I joined Facebook kidney groups, and it was other patients who really just kind of like started slapping me around. My brain wasn't working. I did find a naturopath who focuses on kidney disease, and thanks to her, she really kind of organized my thinking. But I took off from there. I essentially sat here in this beautiful place looking up whatever was wrong with me. And I had so many abnormalities. It wasn't just, gee, how's your creatinine? What's your GFR? My uric acid was abnormal. My parathyroid was abnormal. My cholesterol, which used to be low, was high. My blood pressure, which used to be low, was high. Blah, blah, blah. It kept going on and on. High potassium. Nobody knew what to tell me. So I started reading, and then I started writing. And in time, I started a Facebook group for patients who were in stage 3, which is the beginning of when allopaths say kidney disease starts. But when you really look at it, there's already 50% loss. And once I realized that, it kind of alarmed me. And the other thing I found was, stage 3, that's a GFR from 30 to 60. Nephrology actually says, come see us when your GFR is lower than 30 and go see your primary care doctor for the rest. And nobody knew what to say. And then I just started, being a fanatical researcher for my own benefit, and came to understand that stage 2, which is pretty much ignored, laughably so. Don't worry. There's a lot of things that are changing that we who know functional medicine can really step into early on. Dysbiosis, when the gut bacteria get out of whack. There's a relationship between the kidney and the gut that's huge. The uremic toxins, they call it, but it's way worse than we thought. So, there's a start to start looking at how do you treat dysbiosis. We know how to do that. Endothelial damage is enormous, and it starts in stage 2, and we know stuff to do about that. So there's that. Mitochondrial changes. We know about that. Functional medicine is a specialty of looking at subtle changes. And so I really had to embrace that whole body of knowledge, which even then it wasn't focused on kidney. But, having the internet is a miracle. And I've been able to really weave a lot of stuff together. And, you kind of call the basics the low-hanging fruit. Diet, enormously important. And we can talk about some specifics. Sleep is enormously important. And there's vicious cycles, it's like kidney decline messes up sleep. Sleep problem causes kidney problems. And there's all these little vicious cycles, which my intention was to change them into precious cycles. Fix it, reverse it before it's so serious that it's a lot harder. Hydration, exercise, of chemicals. Right before we started talking, I'm working on a section for my current book on glyphosate and the very specific damage that it causes to kidneys. Okay, oh, GMO is bad, but this is like specifically bad for kidney. And yet not one of the 5 specialists I saw even mentioned that. And so in a way, I mean, we all have kidneys. We all live in this toxic planet at the moment and have to choose, how we navigate. And there's so much research. I mean, there's so much that, so I would go see these doctors, the kidney specialists, and essentially get scare tacticked. They would tell me how I was going to decline, and you can't recover. You will get worse. You will get worse. Was told to me, oh, don't worry about diet. You'll get worse no matter what you do.
What?
Like, what? So just as an aside, by the way, for who's listening, my last GFR was 60. And
Ooh.
that was like a victory moment for me to realize I still want to see it further into stage 2, but I got stage 2 or bust. And so there
You
are
should make
things
a bumper sticker that says that.
that's
Well,
right.
I think though the problem is for like listeners out there, and Robin and I are both doctors, medical doctors, and it's frustrating because our whole I guess our whole profession, it's all just compartmentalized now. Like, oh, kidneys, go see nephrologists. And if you have a liver problem, you see GI, and neurology, go see, a headache, go see neurology. And the problem is no one is looking at the whole person. And like you said, diet and glyphosate and sleep. So when we're looking at kidney disease, I feel like it's just, no one even wants to deal with it too. Oh my gosh. Like working in the ER, like we deal with acute kidney issues or chronic kidney issues and acute issues on top of that. But I mean, calling in the nephrologist and talking about giving bicarb drips and all of that, like the kidneys are tough. I mean, it's a delicate balance. And the thing is though, it shouldn't be a scare tactic. And but this is it. This is all nephrologists have to offer. They have, maybe minimal diet recommendations to decrease phosphorus. Then, you're giving peritoneal dialysis as a choice once you're in stage 3. And then you're on, actual
Stage 5.
dialysis. Stage 5. Yeah, sorry. So stage 5. And then the problem is though, that there's nothing in between, and they just follow you until you decline and you need those things because there isn't a drug to fix it. But we will get into peptides later, but I remember when Robin was sharing her story in our group, and my mind was blown. I'm like, wait, what? You can reverse kidney stages? And I don't think you know this, Robin. So my father-in-law, he ultimately died of his kidney disease. And the most heartbreaking thing is I remember with him before he was going into a cardiac surgery he had to have, because if you guys, I should explain this a little bit. So kidney disease makes heart disease worse. Working in the ER, yeah, it's just a circle.
A total vicious cycle.
And this is why we need to, this is why, Robin, I'm excited for your book and want you to get your story out there. So we could change lives. But yeah. I tell my husband, I have like such guilt because I was just starting in my integrative residency and getting into all of this, because I saw the light and he saw the light too. And I had lunch with him and he's like, Jenny, I'm ready to change. He's like, after this surgery, I'm ready to change. And he passed away a couple months later. Because in the rehab facility, he had caught equina. He went to the ER and they thought he was a pain seeker. It was a terrible story. But this is why, like, I am so passionate about this, because I know we can help people that should have been helped, like my father-in-law. And we'll talk about peptides later, but like MOTS-c, the research behind it in kidney disease, I am appalled that nephrologists aren't talking about this. And I get angry. And I do, because
I
I'm like,
understand why.
the research is there. Well, you're probably even more mad than I am. But
I sort of have PTSD around it. I wanted to say one thing is early on, I met a retired nephrologist who teaches in Hawaii. She does like a island to island telemed kind of thing. And what I gleaned from her has been part of the motivation. Statistics. And I just read this in another article just last week. Like I don't know, like 50, let's say 15% of the population has what we consider CKD, chronic kidney disease, which is GFR 60 and below. So in my mind, the amount of add stage 2 to that, and it gets even bigger. However, 0.06, I think was the number for how many of those people are on dialysis or transplant. So in other words, the majority of this disease isn't anywhere near dialysis.
That's
But
good.
I have, one of my PTSD stories was, I think, nephrologist number 3. And I wrote up very clearly, I write up my history for physicians I see. And I said very clearly, I am not interested in doing dialysis. I just am clear about that. That isn't happening. And so this very nice looking, attractive nephrologist says to me, so will you be willing to do dialysis when you're 95? And I was like, no. Well, how about when you're 85? No. It's like one of those weird moments. What about when you're 75? Mind you, at that point I was like maybe 68. And I took a breath for a moment and then looked at him and said, why don't we talk about what I need now, like diet? And he said, and protein. And he said, oh, they don't even know what amino acids are. I don't bother talking about that with patients. And I said, well, to tell you the truth, I could give you a lecture about amino acids. And he's like, no, I just don't do that.
But
And that
but
was
that's
it.
doctor is teacher. That's what doctor means, I mean, it means doctor is teacher, and we're supposed to teach. And I think that doctors get frustrated, maybe, to give them credit, if a patient comes back, they're not interested in making those changes, because let's admit, like, it's hard to make those changes. It is
Yeah.
hard to live a healthy lifestyle in the world we live in right now. It's hard work, but your health is worth it. But I think the doctors get burnt out, and so then they don't even educate at all. And my whole thing is, if you keep planting those seeds every time they come in, or even better, you lead by example, and,
That's
and they see
important.
that. Yeah. And they see you leading and walking the walk every day and talking the talk.
You can start with something. I mean, I've done this kind of practice before I was so focused on kidney. It's always like, okay, this might take a year. Let's start with one thing. I was doing diet work with teenage boys who didn't like their pimples, and they were willing to make changes because it's like, well, I can show, let's start with something. Let's start with what you drink. We'll do what you drink for a month. Okay, then you come back, we can do, what you eat for breakfast. I'm just very slowly. I mean, it's obvious that diet is a huge thing with kidney disease. It's enormous. And I think I write book titles instead of books, but I'm working on it. And the other one that I'm working on will actually be a hand-drawn book called My Kidney Kitchen.
Oh,
And
cool.
yeah, to make it really it's an organic process. This isn't, some computer program. It's my life. It's my kitchen. It's my body, and so what I put in this body is what I'm going to get back. And, there's a lot of talk in the kidney community about be a kidney warrior. I'm into being a kidney yogi, flexibility, adaptation. I don't need to be in another war. And there's really something about cheating. A lot of the patients talk about, oh, I cheated. And it's like, I'm an adult. I don't cheat. I choose. If I choose to eat a piece of chocolate, okay, now I know I'm getting lead poisoned by it. Oh, great. Along with, do I want the sugar? Do I want the phosphorus? And it's a choice. And sometimes I do. But if I have that choice too often and I don't feel good, I just get to tell myself. And so that's why I kind of had to come up with this thing called renology, which is the art and clinical science of kidney success. early on, you can succeed very easily. I mean, I've helped some people who were way down in the teens in their GFR get up into the 40s. They feel
Mm,
much better,
that's
and they're still in
amazing.
process. For people who are listening, even early on kidney changes, take it seriously. There are people who have early kidney stuff and they get a bad flu, boom, they're really sicker. It's a very vulnerable organ. Once it has some damage, you're really at further risk. And when you mentioned about heart disease, I mean, it basically is heart kidney. Cardiorenal is really one disease. And we talked a little bit about the vicious cycles, and I like to think of it as turning them into precious cycles, that once you step in and make the decision, and it's about self-love. It's really about honoring your own life and finding other things in eating junk. I mean, I used to eat Barbara's jalapeno cheese puffs while I dictated my charts back in the days when you dictated charts, and I was like, rah, rah, rah. At a point, it was like, I'm doing this and I'm harming myself. Why am I doing this? So soda, out, out the garbage, processed foods, even eating out um, is really challenging because the kind of oils causing inflammation is not safe. Non-organic food really is more dangerous. We know that it isn't pure. I mean, there's glyphosate put on foods that are called organic after they're grown. But, that's why I grew a garden and try to, know the people I'm getting my food from, so that it's it's such a priority. I was always a night owl, and using peptides has really shifted my sleep cycles. So anyway, diet, it's an individual thing, but give up red meat. Red meat and kidney are just not friends. Cheese, one of my more favorite relationships in life. I broke up with cheese because it's just too harmful for kidneys. Um, I'm not a great water drinker. So what I do is I put a little bit of tea in my cup and fill the rest of it with water.
Mhm.
It counts, it's like you have to find the adaptation and not pretend, oh, I'm fine so far, so it's good. Because at any moment, things really can happen. And the trouble is not getting a whole lot of support from the clinicians who you depend on. If they are not educated in kidney, it's a lot of like, don't worry.
Right.
And I did worry. I mean, I didn't feel good. And so, the whole thing of toxins is another enormous one. I mean, I went through my house, my pantry, under the kitchen sink, under the bathroom sink, in the garage, no exposures. I hire people to paint things that I used to would have readily painted. I don't want the fumes. Inhalable toxins affect the kidneys. Toxins in our water, in our soil, in our food supply, cleaning supplies, makeup, hair things. And so again, it's really about rhenology, kidney success. And, I didn't do it all overnight. This has been a very slow realization, like, oh, that too, next step, and so it's just starting with something. What did I say? That the expression, do no harm. Part of my drawings for my kidney kitchen is do no harm to myself.
Right.
Contact the physician within. It's like the healer is inside of me, and I get advice from other people, but ultimately I either do it or I don't. And so
Right. Now, could you talk to us a little bit about amino acids specifically with kidney disease, like stage 1, stage 2, maybe even stage 3, and then go a little bit more into the red meat. And protein in general.
Yeah, protein is the huge one.
I'm okay with patients that don't have kidney disease eating red meat as long as it's grass fed. But
Yeah.
can you explain why, if you are in one of these stages, why you think it is not good for the reasons?
Well, it seems like there are a number of reasons that meat is an issue. Nitrogen is the thing that kidney struggles to offload. Um, Animal food is very acidic. And you mentioned bicarb drips. Well, the way to avoid getting so acidic with kidney disease is with diet. A way more plant-based diet allows you to be more alkaline. I also take bicarb tablets to facilitate that, even though I have a very veggie loaded diet. I still do that. And um, carnitine, which we all think is so fabulous, actually is a uremic toxin for people with kidney disease. And that meat's where you get that. And I agree. I mean, I have a husband who's 70 with a GFR of 110. So, the fake news that everybody as they get older lose kidney function isn't true. And we have beautiful venison on our island. And so, I mean, he eats it and I don't. The dogs get my portion. They like that. I don't eat egg. I had an issue. The surgeon left me with a damaged bowel. Very unfortunate complication of the surgery. Um, and so I had very early issues with potassium and phosphorus. Those are two things that anybody starting in stage 2, you want to know. It may be normal for you, but for how long? If there's a decline in somebody's function, then pay attention to your labs. Watch the CO2. Are you too acidic? You can change that. So that's where the animal food comes in as more of a hazard. With dysbiosis, uremic dysbiosis, with the nitrogen and ammonia and acidity issue, and phosphorus also. Animal food has 80% absorption of its phosphorus, and plant food has about 40%. So what about phosphorus, which everybody needs? But with kidney, if you're not excreting it adequately and it starts elevating, it sucks calcium from your bones and puts it in your arteries. Two problems you don't want. And those are two known problems. Bone disease is a known thing with kidney, and artery disease is pretty much a guarantee. And so that's the meat part of it.
Where are you
And
getting your protein sources, and how much protein are you eating?
so the advice is 0.6 to 0.8 grams of protein per optimal weight in kilograms. Little complicated. With your phone calculator, you can figure out how many kilos you are. And I tell people, use chronometer, get a scale. It's a pain in the neck. I will admit it, weighing everything and, but once you've done it for a little while, and I think everybody should, every doctor should, because do you know how much selenium and magnesium's in your day to day? Nobody really does, but use chronometer, you get a sense. And so you can really see how much protein you're getting. My protein, I was vegan for a long time back decades ago, and was a vegan chef, in fact,
That's
before
cool.
I went to med school. And so it's not a challenge to me. I mean, we eat gorgeous meals, and so I depend on legumes and nuts. And believe it or not, broccoli has protein. I mean, everything else has protein, so it adds up. And I love tofu. I am not a soy hater. I think for kidney disease, I mean, soy is a fantastic protein, especially tofu, because the you take the skin off of the bean to make it, and also with tempeh, and that's where a lot of the phosphorus risk is. So your amount of protein per phosphorus is much better that way. And
Yeah, and you're eating it like not in a plant-based burger or with all those bad oils. Like you're
oh yeah,
actually doing it nutritiously. Yeah.
oh
And
yeah,
and
I
I
have
think,
the nasty face for those. All of a sudden, this
yeah.
plant-based burgers are, but I mean, let me tell you how easy it is to take a bowl, squish up some stuff. It could be the leftover broccoli, some onions, garlic, either your tofu or your lentils or your garbanzos, mush it up. I don't do gluten just to protect my gut and, the whole thing going on. It was like, it's not worth it. I use organic white rice flour, low
Mm.
phosphorus to bind stuff with. Now that I'm better, I can use coconut flour, I can use almond flour. But again, everybody has to know what their labs are to know, can I handle this? Squish it together. I make like little tofu falafels
Mm.
that are fabulous, and then we actually bought a Soy Joy G4 machine, and we make soy milk from organic beans, which we then make into yogurt. You get a special culture that's not a dairy one, so it grows
Mm.
in vegetable sources. And then we strain that and have a cheese.
Oh, you make your own cheese. That's
Cheap.
so cool.
I mean, you make enough to last for the week, and it's amazing. And
Yeah.
so it gives me a lot of variety. Um,
And
you know,
you're getting enough because you do want to make sure you're getting enough
oh
protein.
yeah, and that's a risk. Although, further advanced kidney patients, they will actually, some of the more enlightened nutritionists will offer very low protein diet, like 0.3 grams per kilo. That's low, with the supplementation of amino acids that instead of nitrogen, the nitrogen's taken off and a keto molecule is put on. So it's called keto acids.
Mm-hmm.
And and there's two products out that do that. And that's a way, to really lighten the load. And I've done that with a few people to like give them a break and then slowly start adding it back. Because, nobody wants to live on pills and powders for protein. It's just,
Right.
sort of too science fiction-y.
Are you doing a decent amount of amino acids, like pills or powder, or no?
No, no, I
Okay.
depend on my food for it.
Okay.
I mean, I
But
do NC, I do NAC, and
mm,
and then all these peptides are amino acids, but I don't
true.
consider them, for protein. I mean, it's really not hard to get adequate protein. Surprisingly, I mean, 0.6 to 0.8 grams per kilo isn't that much protein, and it's very doable. It's more likely, when people start doing chronometer, they realize they're up to like 1.2, which isn't safe really. Even though there's this big push with the, high protein, high meat diets, we know that some people with, they thought normal kidneys decline. I've seen plenty of people do it, like some carnivore people end up with kidney issues.
So you are seeing that like long-term carnivore, because I'll use the carnivore diet therapeutically in patients for 2 weeks to 4 weeks to reset
Yeah,
gut. Especially
that's
if for
different.
some reason we can't heal their gut dysbiosis because they're pregnant or breastfeeding. So we'll do it short term.
Yeah,
I
that's
feel
different.
better on higher protein because I'm trying to, because there's the flip side. I turned 40 last year. I'm trying to battle sarcopenia and that
Yeah,
muscle wasting that women get. We lose 1% of our muscle mass every year. And, so I'm trying to hit protein
yeah.
goals. Yes, yes, I'm lifting. So I'm hitting protein goals. I'm at, I try to hit like 120 grams of protein a day, but I am watching my kidney function at the same time. And
And
and that's where I think, I wonder like, would eating a bunch of vegan glyphosate covered food versus eating high protein, what's worse for my kidneys, right? So
oh yeah, no,
I
you don't want
also think that's a difficult battle. So yeah, but I wonder specifically with genetics too playing a role with the like the carnivore type people that are just eating, steak for breakfast, lunch, and dinner. I mean, it would be interesting to share their labs. I mean, sometimes they share them, but
Yeah. Yeah, I mean, it's so individual. I mean, everybody's body reacts so uniquely. The other thing I was going to say is, we use GFR, glomerular filtration rate. However, it's really not the best test in the world, and it's kind of a made up test. And it's nice to also use cystatin C, which doesn't depend on the size of one's muscles. And so that, that's just another way to know, because I've seen some people who's had good GFRs and we got a cystatin C and it was like, oh, okay, that's really what's going on.
Can you explain that a little bit more detail?
Well, creatinine, which is the other thing that we measure, is affected by the amount of meat in a diet and the amount of muscle on a person. And so it can skew the results and confuse the results. You don't know, what is this not, you get a number, it's like, okay, what does this number actually mean to me? And if it's confusing, then you just don't take the right action to deal with it. It's like, I don't think people have to flip out. Oh my God. I mean, I chat with people who are newly diagnosed and it's total panic. I mean, it's funny to me because I was there. I remember the feeling, that munch picture where you're like, ah, because the first question people say, oh, are you on dialysis? No, I'm in stage 3, that's like decades earlier, or maybe not at all. And so, having other ways to look, this gives you like more stuff to fine tune. That parathyroid is a problem. You know, glucose toxicity, with the amount of sugar that seems to have been considered normal in our community. I mean, that too hurts blood vessels, which means kidneys. And, that's another one of those cycles, which is why personally, after my function went up, I was like depending on white rice noodles to fill up my calorie needs. When I was much sicker, I was really my potassium being elevated. I mean, I couldn't eat half the stuff that grows in Hawaii. I couldn't eat it. And so as I was seeing stuff getting better with low hanging fruit, meaning I was getting a NutrEval test and replacing things that was abnormal, supplements that I found incredibly useful, alpha lipoic acid, NAC, magnesium. I didn't need vitamin D because I live in the sun. But that's certainly one. I mean, there's a whole long list of things. Medicinal mushrooms, eating maitake and lion's mane and shiitake. For a while, I was taking them as a tincture. Now I figured out a way to get stuff from Whole Foods, and I'm eating shiitakes pretty much every day. Finding ways to make food your medicine. Nitric oxide is one of those things, and so early on I was taking nitric oxide supplement, I'm forgetting the name of the product. Anyway, the Berkeley Life nitric oxide, which I found safer for kidney than the other products. And it still was low. And, okay, my potassium was high, so I wasn't eating beets. Oh, arugula, I don't really like it. I love it now. It's the best source of nitric oxide. I'm growing it. I eat it with everything. But I overheard a conversation where someone mentioned BPC 157. And at that point, I'd actually gotten my GFR up to 50, which was considered like unheard of.
With
even
BPC 157?
Before peptides.
Before peptides. So you were at 50 before peptides. And then this is when your peptide journey started?
And then I started doing BPC, which
Oral?
stands for body protective complex, no, injectable.
Injectable, okay.
And also I actually now I take both. I do the oral and do injectable, kind of sequence it. Thymus peptides are amazing for kidney. You mentioned MATA-C, which the mitochondrial peptides, including SS31 and humanin, which is harder to come by now, are also stunning because the tubules, so, the little kidney units, there's a glomerulus, which is basically a clump of blood vessels and a filter through which everything goes through the system of tubules. The tubules really is where the action starts. Some diseases are glomerular, but honestly, what I've figured out is we do not monitor anything to do with tubules, and yet that's where it starts. Toxins have to get figured out. I call them like the discernment. They decide, is this safe? I'll keep it, or no, I should get rid of it. And that's a mythos for life, because to have healthy kidneys, you decide, is this person too toxic for me? Is this food too toxic for me? I'm going to be a kidney. But the tubules are loaded with mitochondria. Those are our like little energy makers. And so early on, doing mitochondrial support in that way, I mean, including CoQ10 and vitamin E, there's other things we know to do, but peptides just really, once you take care of getting the poison out of your diet, because living in this modern world is really easy to eat stuff that has poison in it. Don't stop. It's like punching yourself in the face. It's like, why would I do that? I don't like feeling bad.
Right.
And so the peptides, on top of some healthy choices, they're signaling molecules. So it kind of approaches a body and reclaims chemical pathways that seem to have been broken. And so there's two kinds of peptides. This is my utter passion these days for those who are listening. The very small ones, 2 to 4 amino acids, basically, they get through the cell membrane, through the nuclear membrane, lodge in DNA, and actually have the capacity, the ability to reverse epigenetic damage, which means the danger of living that damages our ability to make proteins that we have to survive on can be reclaimed. I mean, that's like a miracle to me. So those really were discovered in Russia, and the research is enormous over decades. One aspect of the passion. And then the other ones are bigger. They used to be up to 50 amino acids, and because of influence from the pharmaco industry, it's now been changed to 40. That's a whole nother conversation, but those require a receptor to get into the cell. And they'll say very fast half-life. Like once they hit that receptor, they may not even be, you can't even find them. And so earlier on, people would say, oh, well, they don't do anything. But that's not true. Once that receptor is tapped, a whole series of downstream effects can happen. And they're adaptogens, they're modulators. So like one's, if something's too high, it'll bring it down. If something's too low, it'll bring it up. And that's an amazing benefit to most of our pharmaceuticals. Go in and they're anti this, which is wonderful when you need that. But sometimes you need modulation, and things change over time. It's like fluctuations. And so it helps the body adapt, which is really where kidney disease loses the memory of how to do it.
And you're not going to have the side effects, because these are peptides, are chains of amino acids. Insulin is a peptide, and they work with your body. And that's why it's so amazing. So you started out with oral BPC 157 and injectable. And then you said you added on some thymus peptides and then MOTS-C, right?
And I've really had a delightful time with the anti-senescence therapies. I shouldn't say delightful. The first time I did a series, I had a Herxheimer reaction and got scared because I was like, uh-oh, what did I do to myself?
Which one did
And
you use?
I used
Thiamoxane?
Foxo 4 dry.
We used Fox. Well, okay. So you kind of had a
It's
herx.
a
Okay.
very
So
expensive option. And I ended up scared for 3 days.
what did you do?
You know,
Yeah.
a Herxheimer reaction means that things that you don't want die, and then the body has to like deal with getting rid of it. So I just, did what I usually do when I don't feel good, hang around, drink, lay on my amethyst mat and do some writing. And then all of a sudden I was like, whoa, I feel so good.
Yeah.
And I thought, well, maybe that was a Herx. The next time, because I did it 3 months later, no Herx. And so, I mean, people see me and they're like, wow, you look better, you act different. My mind is clearer, my ability to tolerate exercise, my ability to tolerate annoyances, that sort of nervous system is so much better. And thank you God, I'm eating a lot more. I
Yeah.
live where, avocados grow this big and I wasn't eating it, high potassium, papaya, I mean, so many beautiful things that come from this land here. And now I'm eating it. Bananas, I grow great bananas. I wasn't eating them, I was like, oh, and so there's really a reason to make all these efforts, it's like going to school. I mean, school wasn't fun, all these stupid tests you don't want to take, but ultimately as adults, we make sacrifices to make gains. And with kidney there's just no doubt. And it really, the beginning is, where's my willingness? Who am I fooling?
Yeah.
you
And
know
you felt bad, right? I mean, you
I
felt
felt
bad
bad.
when your GFR was when you were losing the kidney function, and now you feel good again that
I weighed
you
82 pounds. I
yeah.
lost a lot of weight. I mean, talk about sarcopenia. I was, like, oh my God. And I'm still working on it now. I'm like, last time I weighed myself, I was 95. Yes.
Yay.
And
You're
I
getting
and I
strong.
dig rocks up, and as the weather gets warmer, I'm gonna start swimming again, which is a wonder. My husband went out in the water today, but I don't have enough body fat to tolerate it.
Right.
So it's really willingness and not listening to the don't worry. Don't worry about it. Well, it's not worry, it's self-responsibility and self-love. And besides, I don't want to inconvenience the people around me who would have to take care of me. It's like it's not really, a good destination to want to stay sick with a chronic disease. It's just like, why would I?
Right.
And after decades of counseling patients on how to make changes, it was a lot easier for me to, kind of have this conversation with myself. Okay, I want to eat all that chocolate, but okay, I won't. It's really, that's really the trick. And how do you find that? Um, SNP testing, the little genetic abnormalities that all of us get by being alive. I did testing and had so many things wrong. It was like, okay, one thing at a time. Methylation, deal with that. Oxalates, I'll deal with that. There's so many things. And the thing to know about kidney is it is a systemic disease. There's the kidney brain axis, there's the kidney liver axis, there's the kidney gut axis. It's all connected, and our blood goes through the kidney and brings messages from other organs, and inflammation from one part of the body affects the other. And so, the end point of inflammation is that the kidney will scar and stop working. And I even really believe with things like peptides that you can even reverse some of that fibrosis, that scarring. But it's a lot harder than just don't get it to happen in the first place.
Right. That's the big thing. Well, you had your circumstances were a little bit different with what you went through, but at the same time, because you went through it, now you can share your story and help others. And I guess I'm sure people are wondering, like, how can they take this route? How can they do what you did? How can they find people like you, or can they work with you if them or a family member has some chronic kidney disease?
Yeah, I mean, that's part of my goal is getting other doctors to know enough to guide people, and it's really lacking. I'm not doing a regular practice right now. I do some consults with physicians to help guide them so they can take that on. There are some functional nutrition kidney dietitians who are doing some good stuff. I still think, having a physician available. There's a growing number of functional kidney docs here and there around, not enough as far as I'm concerned, but there are some. And I suppose that's another project, which is to get a practitioner guide together. And I think Dr. Majd Isreb, who is one of our wonderful integrative nephrologists, he's putting together that kind of guide, because he can't see everybody. There's really a need for this. However, your question is, what could I do if I find out I have some deficit? And that's like, find out if it says, if your GFR greater than 60, find out what number it is. Ask, because there's formulas to figure that out. That number's stupid, because is it 61 or is it 91? Like, what number is it? Because a GFR of 61 is going to be way different than 88. Every little, it's not incremental. It's like a quantum leap of difference. And so, first things first, are you drinking enough water? Where's the source of your water? Is it, from a plastic bottle, so you're drinking microparticles? Or, okay, that's an important thing. You can actually even buy little dipsticks and monitor that for yourself. Amazon has them. You can see, am I too acidic? Do I have glucose? Do I have protein? I mean, people who have protein in their urine, you need to know this, deal with it. Salt, too much salt, back off. It's just not good for kidney. That doesn't mean none, because you can hurt yourself with none, but if you've ever gone out to eat, you just ate too much salt.
Right. Yeah.
If you have a Pepsi, it's sodium. They call soda for a reason. Sodium. It's like,
Yeah. Don't
don't
drink
do
pop.
it.
Yeah.
Sugar. Start assessing, am I a sweet addict? Be honest, it's like between you, yourself, and yourself, it's like to decide that. And then chronometer's free. It's an online thing. Start assessing. You can see, maybe I'm not getting enough magnesium. Oh, that's something easily added. Vitamin D level, easy to get. If you're eating excessive amount of meat, start looking at what do I like that I can integrate. I don't know anything about tempeh. How do you cook it? Oh, okay. I have serious meat eaters come over, and I'll have, like tempeh tacos. They're fabulous, and they're like, wow, I love this, and it's just some mindset, that being vegetarian is weird. It is weird in a culture that basically depends on meat, but if it's going to save your life, all hail tofu, and look up recipes. Decide whether you're getting a good enough sleep. I used an Aura ring for a while and found out my deep sleep was actually good, and I'd used some peptides to enhance my sleep, but my cycles were stupid. I mean, I was wanting to stay up to 2 a.m. and sleep till 10. And yeah, I just didn't think that was wise. I supplement melatonin for many reasons. And I just found out, this was a nice little factoid, that melatonin enhances thymus levels, and the
Mm,
body can't make different thymogens without having adequate
enough
melatonin.
melatonin. Interesting. Yeah.
Kidneys are
And
responsible for putting melatonin together. So it's like, oh, so
yeah,
am I getting the adequate sleep? I wasn't getting good REM unless I slept later in the morning.
mm,
Now I try to force myself.
no, it's better.
Light out before midnight. Okay, let's try.
Yeah.
It's
Sleep's tough. And that's the thing, sleep is so important. And, being on devices is going to suppress that melatonin. Like you said, we need that melatonin to release the thymus peptides. And also, we also need melatonin as an antioxidant.
right.
So it is very important to get in good habits and like circadian rhythm, all of that. Sleep is a really big issue for people.
Huge.
And
So
it
many people don't sleep well.
Yeah, and if it's directly connected to kidney health, that's something really important. And that's like the pillars of health, where, movement's also important and
I
breath
was going
work.
to say, you can't not
Yeah.
exercise. I
Mm-hmm.
mean, even if it's doing your leg lifts in bed.
Yeah, that's a good idea. Before
Have
you
my
wake up, do
hospital
some leg
patients, it's
lifts.
like, so are you exercising? I'm like, I'm in bed. I'm like, here, move over. Let me show you. That's one of the best gym classes I had to take in college, was laying on the floor doing leg lifts in different directions. And actually you can get a good workout sitting in your chair. Yoga is really fabulous to do. And also some form of meditative, creative time, changing those brain waves, because there are various things with kidney disease that causes excessive sympathetic nervous system bursts.
Mm.
There's an enzyme called renalase, and renalase gets low, and what renalase does is helps you break down your stress hormones, your catecholamines, and if you can't, they're still circulating. And so a stressful event happens, and the next day, and you're still thinking there's stress. It's like, oh, I haven't excreted my stress hormones. Also, with a COMT defect, you really got
Mm-hmm.
doubly, triply problem with this, and so it's like the basics, as you say. I mean, these are the low hanging fruits. You don't need a diagnosis of kidney disease to do this, and yet motivation is hard to come by. I'm busy. I got blah, 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 blah. Oh, wait, my priority is I don't want to decline. I mean, I'll tell you what, a GFR of 30, life had a dirty tinge to it. I mean, everything just didn't feel right, toxic. By the time I got up to 40, it was way better. 50, it was, and so, every little bit makes a difference. And it's slow. It's not like, well, I changed my diet last week and it hasn't changed. It's like, no, it's like a big ship that takes time to turn around. And I realize it takes us a long time to get these bad habits. They're adaptations to busyness in life. I mean, I was eating organic, like fast meals, like
Mm-hmm.
Barbara's or some of these when I was on call. Oh my God, I got to go to the hospital. Now it's like, no way. I travel with food. I go to other people's house. I bring the food I'm going to eat. I go to a potluck. I bring what I'm going to make, what I'm going to
Mm-hmm.
eat, because I won't eat other people's stuff. I don't know the oil. I don't know how much salt is in it. I don't know what they did. It's all beautiful, but I'm just sort of, I call it kidney kosher. It's like I'm really strict about it. And organic to me is a kind of kosher these days. I don't want those things in my body. I
Right.
can't have them in there.
Yeah, you're protecting your kidneys, like you said, and your heart too. So
Yeah, all of it.
yeah, and it's okay to advocate for yourself. And I
Right.
I also like if I'm eating a certain way, and especially at a restaurant, or asking questions like what oil is this cooked in? And people like, I don't know, like I don't care if people think I'm weird, but I also use it as a time to educate, eating gluten and bread, and my husband will eat it out when we're out at restaurants, but I won't. And sometimes I'll make him take a DG block before, and people will be like, what's that and why? And then I
Mm,
talk about glyphosate and every
yeah,
little bit to educate people, because I mean, my passion and most of our listeners, we just want people to be healthy, right? And most of us have had health crises and have not found the answer in conventional medicine, and actually have, told like, oh, you're just going to get worse. And that's just not good enough answer, because our bodies are amazing, beautiful creations.
yeah. And that's a limbic system assault in a
Mm,
way.
you're
You know,
right. Mhm.
threats. I mean, that's another book on my list of things to write with my very own cardiologist, in fact, um,
Oh.
on medical cursing.
Yes.
Affect
Yeah, and
because
my fellowship, we talked about this. Yes, let's have you explain that, and we'll end with that. Yes.
you know we're all vulnerable to the energies and opinions and and effect of other people on us. And when you go to see a doctor, I mean, even me as a physician, I'm a little bit sort of assertive as a patient, mind you, but even so, you don't feel good, you want help, and somebody to sit there and tell you this is how it's going to go. Our brains take that in and start making a story out of it. And so You know, I was told by my oncologist early on, don't call CKD kidney failure. You're not in failure. That's later. Um, I really find the term pre-dialysis as a diagnosis beyond offensive, because that tells you you will be on dialysis unless you die before then. Oh, great, thanks. And without anything of, I have a list now, I think I'm up to like 16, the 16 R's, which has to do with remediate, reversal, reconstitute. I mean, there's a lot that we can do that goes past the very basics that we all know about. And of course, doing them is way better than talking about them. And so do no harm to myself. I can curse my own life in that way by assuming I'm going to get worse. I don't feel good. If you don't follow my advice, you will. I mean, the last nephrologist I saw basically looks at me and she says, "You're taking too many things." And I said, well, oh, have you noticed my numbers? I was at 51. I was like, look at me. I felt
Mhm.
really good about this. She didn't even mention that. She just said, I haven't read about these and you shouldn't take them. And if you keep taking them, you're going to get worse. And I'm like, but I just like went up 21 points from where I started by taking these things. Would you care for some references since you haven't read about them? No, but we need to see you again in a month and we'll do, and I went home like shaken. And
Mm,
then I kind of got this, I had to get like fierce about it and say,
mm,
no, Miss Nephrology lady, you are not getting my goat here. And next stop, it was 60. And so, finding somebody who knows about kidney and peptides is a bit challenging. And that's part of why I'm doing the educating I'm doing rather than, seeing a lot of patients, which I miss actually. But for
mm,
my own health and sanity, I decided this is the route. And I'm happy to work with people, with their doctors. Most, if functional docs are really open to me, helping guide. I don't need to charge money, which has made it really fun because I can do a little guidance without it being financially burdensome. It costs a lot. I spend a lot of money on supplements. That's the antidote to this cursing. And the other thing is the fear in kidney is a Chinese medicine wisdom. And so, I constantly am doing like mental cleanse, get those curses out. The curses can be the poisons in my world. It can also be my own habits of negative thinking. And so it's constant, and I don't see it as a negative anymore. It's
Yes.
like that's why I love the term renology, because it's about success.
Mhm.
We can succeed and find happiness with kidney. It
Oh,
sounds kind of crazy,
absolutely.
but it's true.
That's great. Well, thank you so much, Robin. You're amazing and inspiration, and I'm excited for all your books. Where can people find you right now if they want to?
Probably Facebook is the easiest way
Facebook. Okay.
to find me
All
and
right.
actually
Perfect.
get me to respond, because um because I have this group, I tend to look pretty regularly,
Great.
so
Yeah, you're very
I've gotten
responsive on
private
them.
messages, just explain who you are and why if you're looking for me. And there's some good kidney groups on Facebook still that inspire positive lifestyle choices. And
Yeah.
that's really important.
Oh, that's great. Well, thank you so much. Woo.
Oh, thanks.
Thank you so much. And it's been a pleasure to talk to you, and keep on rocking it.
Yay,
Kidney. Yeah,
yay,
that's awesome.
indeed.
All right, thank you.
Rock and Robin medicine.
Yes.